Welcome back, everyone. I hope you enjoyed your lunch. I'm very proud to now welcome our keynote speaker to provide a national perspective on this issue. We are so lucky to hear from Dr. Ben Miller. Dr. Miller is the Chief Strategy Officer for Wellbeing Trust, a national foundation committed to advancing the mental, social, and spiritual health of our nation. Dr. Miller oversees the foundation's portfolio to advance policy. Dr. Miller spent 8 years as an associate professor in the Department of Family Medicine at the University of Colorado School of Medicine, where he was the founding director of the Eugene S. Farley Health Policy Center. The Farley Center was created to be a leader in conducting studies relevant to health and healthcare challenges. And they are also to disseminate evidence to those positioned to use it in decision making as it relates to health policy in our country. He remains a senior advisor to the Farley Center, and Dr. Miller is also an adjunct professor in the Department of Psychiatry and Behavioral Sciences in the Stanford School of Medicine. We're so fortunate to have Dr. Miller with us today. We want to thank you and can't wait to hear your presentation, Dr. Miller.
Hi there, my name is Ben Miller. I am the Chief Strategy Officer for Wellbeing Trust, and thank you so much for allowing me to come on today to talk about a topic that I know is on the top of all of our minds, the issues of COVID-19 and mental health. What I hope to do today is really just to walk you through some data. If we were able to have a conversation, have a much deeper conversation on the impact that COVID-19 is having on our mental health and well-being in this nation. But really, my charge to you is, what are we going to do about this? This is a time for action. It's a time for us to really be considerate and thoughtful of the things that are working and really take care of the things that aren't working to make sure that we modify them so we come out of this crisis in a little bit better place. So I'm going to walk through some slides and describe a little bit about the context in which we're facing as a nation. So first of all, I think everyone knows that this crisis has been one that has impacted us all in different ways. This is what I would describe a critical pivot point for mental health in our country. Most of us who have experienced mental illness in our lives, we might not be that unfamiliar with what it's like to be isolated and disconnected. For others of us, this might be new. What this has done is it's really leveled a lot of our understanding of what social creatures need in times of isolation, and that is we need each other. We're inherently social, and without the ability to connect, it's really challenging and it's sometimes frustrating to each of us. So we've made a great amount of progress in this country. The scientific evidence has advanced prolifically, and we've learned tremendous amounts. But we still have a ways to go. Colleagues and I at the Trust for America's Health and at Wellbeing Trust have done a series of reports that we call Pain in the Nation. What these reports do is they show the trends from 1999 until 2017 or 2018 coming up that show the number of lives that we've lost prematurely to drug, alcohol, and suicide, or what we refer to as the deaths of despair. And I will spend quite a bit of time talking about this today because I think it's essential for us to understand the importance of deaths of despair. But as you can see on the slide, our nation has not gone in the right direction addressing these deaths. In fact, we've gotten substantially worse, and as many of you know, life expectancy had been on the decline for the last 3 years before this past year. It actually showed a small uptick again. But still, in 2020, our country should not be seeing a rise in deaths of despair. We should be seeing a decrease. Specifically to your state, when we begin to factor in projections and how many more lives might we lose, every state, but not all states are the same, every state shows a massive increase. The interesting point about this is that these deaths are preventable. That loss of life to drug, alcohol, and suicide can be prevented if we invest in the right spaces and places and we do the things that we know are going to add most value to our communities. It's a hard game to play, but it's one that we must. So you can see here the projections that we were laying out for the next 10 years in Indiana. And I will say, again, these are just projections. They're based on predictive modeling. and that these deaths have not happened yet, but these deaths could indeed be prevented. Over the course of the last decade, the lives lost have been just exponential. And when you look at data like these, and when you consider the lives that we've lost, it's really important to make sure that we don't lose sight of the person and their family and their community. Numbers don't always have names, and it's essential for us to really feel motivated to do something about this because, as I said, this is the epidemic that we have in our country. We have new data coming out next week that will update this slide. But as for now, we have the 2017 data on here. And you can see that in 2017, we lost more lives than ever before to drug, alcohol, and suicide, 151,000 plus. Now, when you break those deaths down, as we do here in this slide, you can see the substantial uptick in drug deaths. A lot of that has been driven by our opioid epidemic and our inability, frankly, to manage the things that are causing us pain. Because pain, as we say, is not just tissues and nerves, it can also be emotional. So how do we make sure as a country that we are addressing people's pain, healing from that pain, and moving forward together? Well, that was all fine and well and good. And we had a major problem prior to this new microbe, this new virus landing on us and hitting the scene, forcing us all to do things that we've never had to do before, socially isolate in ways that we've never done. And so COVID-19 in many ways has laid bare the failings of the American public health, mental health, and healthcare systems, because we've not been able to respond in a way that is most appropriate for the demand. And a lot of that is just because this virus has taken us all by storm and has really hit us in two areas that I'll talk about more in just a second, socially and economically. Colleagues and I published a piece in The Atlantic last week that really called for the importance of us investing adequately in mental health in this country. That we weren't doing it before the pandemic. We have not done it during the pandemic. And it's showing up in how we ourselves are feeling impacted. So if you look at these slides, we, in partnership with, in collaboration, with the Kaiser Family Foundation, released a series of data points around how COVID-19 is impacting our mental health and well-being. And the slide in front of you today is really about the percentage of adults who are worried about sheltering in place. And you can see here, 47% believe that it's going to have some impact on their negative impact on their mental health. Whereas 37% said that not sheltering in place led them to be worried or stressed. And for us, this is the preliminary data. I can imagine that a month into this now, that we are probably in a very different place. In addition, when we look at how the job loss or income potential or income loss has had on our mental health, we can also see a profound impact here. These data are very clear that this is not impacting us all the same, but it's impacting our ability to cope and our ability to understand, frankly, the uncertainty that's around us in ways that are sometimes provoking us to have higher rates of mental health and stress. And when we look at the percentage of adults who say that they're worried or stressed related to coronavirus and how it's had a negative effect on their mental health, you see the numbers go up here. But what's interesting about these data is that they actually tell us a different story about issues of inequity and disparities in our nation. And I'll show you another slide on that in just a second. But when we can begin to look at folks who have more resources, yes, they're still stressed, and yes, they're still experiencing potentially negative mental health, but look at how much money they're making. When we know that folks that are in that less than $40,000 range are likely to be the ones who have their jobs furloughed or ultimately even lose their jobs. And when we consider the negative impact on our mental health by our health status, if we've had positive health, if we've had excellent or very good health, you can see here that the major negative impact is relatively smaller. But if we have poorer health or fair health, the major negative impact is much greater. And that should not be a surprise to any of you. Many in our community who are most vulnerable are those that have multiple chronic conditions or multiple chronic diseases. And we know that folks that are at higher risk might have other comorbidities that cause them to be fearful, cause them to be worried about how the coronavirus, COVID-19, could impact on their mental health and their overall health status. And if you need another point that really makes clear how these issues are coming in at us so fast and furious. These data, which are already outdated, showed the rise in unemployment in this nation. And there was a beautiful front page of the New York Times that had this same graphic, which was just dramatic in its relief, because at the bottom of the page, you saw the unemployment rates remaining relatively static over the last decade, 2 decades, 3 decades. But then when it comes to 2020, you see a spike, and that spike was actually all the way at top of the masthead. So this is unprecedented. And we don't have, none of us watching this, none of us alive have been able to see unemployment rates like this. As you can see from this, the last time that we saw unemployment rates near what we're seeing now was the Great Depression. And what's made this different, as we'll talk about, is that it's not just the economic drivers leading us to feel more despair. It's also the social isolation and the social drivers. This is another part of the survey from Kaiser Family Foundation. And the thing that stands out to me about this slide is if you look at those who are employed, who are able to work from home, people who are able to shelter in place and still keep a job, it's actually relatively few of the folks that make less than $40,000, 29%, and according to these data, are able to stay home and still keep their job. And when you bump those numbers up to $90,000, it's only about 42%. But if you make over $90,000, more than half of you, almost 2/3, are able to still stay at home and keep your job. This tells us a lot on why this virus is not an equal opportunity offender. While this virus will impact some communities more than others, because those that are going to have to be out and more exposed are likely in communities that have lower socioeconomic status. And typically in many of our states and many of our communities, these are communities of color. And this speaks to the robust systemic inequities that we face as a nation that we have got to tackle, that COVID has told us and shown us are still there and quite pervasive. Multiple studies have come out that look at the impact of unemployment on overdose deaths and suicide. One study in particular was done by a group of economists that looked at, for every 1% increase in unemployment, there's a 3.6% increase in opioid overdoses. That's very telling. And it actually got colleagues and I to scratch our heads a little bit on what that might look like now when we see unemployment rates going sky high, 15% and above. We're seeing a little bit of media attention on the topic, not as much as I think any of us would like, but the media is indeed paying attention at a certain level. And as you can see here from the bottom right, the David Brooks column, there is a struggle between fear and comfort. There is a struggle around how we are addressing mental health in this unique and unprecedented time. But if we look at how our Congress has invested currently, we actually haven't invested very much in mental health at all. The Cures Act, which was specifically focused on providing economic stimulus for so many people in this country, only put $425 million into mental health. And if you want to put that in perspective, that's 0.56%, there you go, percent of the total amount invested in the airline industry, or 2% of the $185 billion that was sent to healthcare providers and hospitals as a whole. Now, many folks in the mental health community might have seen a couple of dollars come their way from this, but the way that these dollars were allocated made it very difficult, if not almost challenging, for the mental health community to receive any of those dollars. And it was based in part on how much money or how many claims you had filed for Medicare. And we know that Medicaid is typically one of the most dominant payers for mental health. As I already mentioned, there are some pretty ugly issues that COVID has highlighted. The map on the right shows the hot spots for COVID and where you can see the number of cases. And when we begin to look at the communities who are impacted the most, at first there was conversations on its urban areas. We don't see it in a lot of the rural, it's density. It has to do with density. But when you unpack those data, though, it actually is not about density. It's about poverty, and it's about where people live. And we've known this for several years now, but when our zip code is a better predictor for our mortality than anything else, we have a problem. And this continues into mental health. The same areas that have had higher incidence prevalence of mental health have had higher rates of deaths of despair are the same areas that we're seeing more cases of COVID. And our nation really should wake up to this fact that we must pay attention to our communities. One size will not fit all. So structural inequities will continue to be there after COVID if we do not address them during COVID. One of my colleagues wrote this slide, and it was really focused on how can we pay more attention to minority mental health with a focus on interventions. And you can see some of those in front of you. And one of the slides that I'll draw your attention to, one of the talking points is that second bullet, which is how can we better identify direct, indirect structural racism as a determinant of mental health. Issues of race, of poverty, really do have a profound impact on an individual's overall mental health and well-being. And if we're not able to put resources towards communities that are disproportionately impacted by racism, by those determinants, then we will see poorer outcomes. This has led many of my colleagues and I to write about the epidemic within the pandemic. The epidemic was issues of disparity, issues of deaths of despair that were here prior to COVID. Now, COVID has laid bare, as I said, some of the failings, but it's also exacerbated the ongoing deaths of despair that we were already trying to address. This means that for us as a nation and us as a community and us and our individual families we must take notice and recognize that if we don't begin to invest in solutions that are meaningfully meeting the needs of all our communities, then we could see an uptick in those deaths of despair. This is a paper that came out about a week ago, 2 weeks ago now, that looked at the additional impact of deaths of despair because of COVID. And what we did was we factored in, 3 different variables. One was around social isolation and being disconnected. 2 was around the economic drivers, unemployment, and how quickly we might recover from that unemployment as a nation, how quickly our economy would recover. And then 3 is the uncertainty that we all feel. There's a fear and a dread that comes along with uncertainty, and we had to factor that in. So we looked at the percentages increased that might occur over the next 10 years from these data. And you can see at the low end of the continuum, if we have a relatively fast increase in how quickly we recover, we could have only 27,000 additional deaths. But if we have a relatively slow increase and at the slow end on the far right, we could have over 154,000 additional deaths. Now, these are the percent change in mortality with 1% increase in unemployment. We know that the data only look worse when we project this out. But as I said to many colleagues, these are predictive models. These lives have not been lost yet, at least those that we know of. And so how could we really impact on these data to prevent the deaths from happening in the first place? And as I mentioned, the estimated additional deaths of despair by counties show a substantial regional variation. In some of the communities that suffered the most in 2008 during the Great Recession, some of the jobs have not come back to those communities. So how do we try and create new and novel opportunities for employment when we're social distancing, when we are staying in our homes and not able to get out because we put ourselves or our families at risk? This is where we've got to pay more attention to the impact of unemployment on our health. That employment matters. And if we are serious about changing and reversing some of these deaths of despair and really going in a different direction with the data, we have to factor in the importance of employment. As I mentioned at the beginning, I work for a foundation called Wellbeing Trust. We've been around about 4 years now, and we invest in solutions that are really focused on advancing the mental, social, and spiritual health of the nation. One of our goals that we have right now is to decrease the deaths of despair by 100,000 lives in the next 10 years. And as I have shown you with data, that's becoming increasingly more difficult because of COVID. Doesn't mean impossible, it just means more difficult. We recognized early on in our development as an organization that there needed to be a framework that explained what should good look like for mental health. And there needed to be a corresponding guide that is used to really provide some key policy recommendations to members of Congress on what they can do and what they can invest in. The end product is in front of you. We call it Healing the Nation. And as I mentioned, healing is what's necessary when we're in pain. We must heal the nation, and we must do so in a very comprehensive and integrated way. The framework for excellence of mental health and well-being, as seen on this slide, really is looking at all the various ways that we can approach mental health and saying that excellence will occur when we begin to prioritize the investment and the integration of mental health across multiple settings. So let's just begin on the left-hand part of your slide here with us, with each of us as individuals. We have an opportunity and a responsibility to take care of each other, that we must learn how to speak to each other in ways that reinforce the support and show that we are available to take care of each other's mental health needs. Now, that's not always easy to do. Some of us don't feel trained or ill-equipped. There's this thing called stigma that still runs around and causes problems for many of us. But we've got to begin by helping each other. And one of the best ways to do that is to take care of ourselves, but also learn how to talk to each other in new and novel ways. The second category, which was what we call vital community conditions, are essentially what some people would refer to as social determinants of health. We call them community conditions because we think they're broader. We think that they go beyond just the individual determinant, and they really look at the impact almost interrelated across our communities. And you can see examples of that. Lifelong learning, transportation, food, health and safety, all of these things are essential in our overall well-being. And if we wanted to make a positive impact across our communities, we would focus almost disproportionately on those areas that you see there. That gets very little resource. In a couple of studies that we've done, we looked at state budgets and how state budgets have not prioritized addressing social services or these more vital community conditions over the years. We've done a pretty good job investing in healthcare, not mental health so much, but healthcare. But the vital conditions have still remained relatively not addressed. The second category is around coverage. This is our insurance. We know that most states still don't necessarily enforce mental health parity, a law that's been on the books for over 10 years now. We could do a much better job standing up mental health parity laws and making sure that our states are doing a good job holding people accountable for our benefits. This third category is around engagement. Engagement is really about how do you make sure that you meet people in all the places that they show up for mental health needs. Our policies aligned with these, so these are not just good ideas, these are actually driven by the evidence and given policies to support them. But how do we better integrate mental health into primary care? Something that I've published a lot on. This is my passion, is how do we figure out a way to bring those two together? That's a wonderful place to start, but is it sufficient? Because we also have to be diverting people from our jails, from our emergency departments. We have to be treating people when they reemerge into our communities from the hospital, from a jail. We've got to be proactively talking to our students when they're in schools and they're having issues. Instead of just constantly referring, let's bring those services to them. And let's think of a way that we could coordinate, integrate, comprehensively finance that type of care. Under each one of these areas in Healing the Nation, we offer up policy recommendations. And as I'll talk about in just a second, you can get these and you can look at them for your own member of Congress and you can talk to them about them, because we believe that we all must bring forward a vision of excellence for mental health in order for our Congress and even in our state houses, for them to understand what we're trying to do, to modify, to change, to transform, to revolutionize how we think about mental health. And then last are the outcomes. Why do anything if we can't measure it? Let's make sure that we're showing that there is positive improvement for mental health and well-being, that by better integrating care, we get better outcomes. By better integrating care, we save money. By better integrating care, we enhance our community's ability to thrive. The URL for Healing the Nation is seen at the bottom of the slide, healingthenation.wellbeingtrust.org. We created both a compendium of the resources that's available in a print off, and you can print that off or we can mail you a copy, whatever you'd like. We've got a paper version of that, but we know that it's hard to get through 100 and some odd pages of a policy document, but it's much easier to go to a website and be able to click a button and find the things that you need quickly. So as you can see here, if you wanted to get information about the judicial system and there was policies that you wanted to understand or evidence that you wanted to grasp around mental health and judicial system, you can actually click on this and it'll drop down and it'll give you several themes that go along with what to do for criminal justice reform. If you want to understand better about our schools or where we work, you can go and click there and you can learn more about that. Our goal here is no matter where you start within this framework, no matter where you start within these policies, that they show you that we are trying to integrate mental health across a continuum of care. We are not just programmatically thinking about one way to approach it. We're saying if you do something in schools, you also have to pay attention to how we address that in a pediatrician's office, or how we have that connected to the criminal justice system. And you can see here laid out in front of you, we have the solutions very clearly marked so that people don't have to work too hard to find them. We have solutions that people can go to immediately. And so instead of Googling, what are the policy recommendations for mental health within our workplaces, you can actually just find it on one site. So what can be done with all of this? Well, first of all, we've got to get people working. And the United States has had an entrepreneurial spirit since our birth. We've got to figure out new and novel ways that we can help people find employment and make sure that while we do so, we keep in mind and protect their overall health. It's one thing to get someone out into work. It's another thing if you're exposing them unnecessarily to individuals that might be sick and they could potentially infect others with COVID. So an example of our creativity are contact tracers. Many of you might be familiar with these individuals. They are tracking down folks who might have been exposed to COVID-19. They're calling them, they're interviewing them, they're asking them where they were, who they were with, and then they're tracking down the other people who they were with. And the end goal is to try and isolate, to detect and isolate those individuals who are identified with coronavirus. Now, what would happen if we gave that person an opportunity to learn basic mental health first aid skills? Or how do we teach them crisis management or some really basic skills so they can identify mental health and addiction needs when they might be present in those communities? If we did that, that would be a game changer for many folks because they would have somebody there who is paying attention to those mental health needs and able to refer or coordinate and at times intervene when most appropriate. And how do we get people connected? I've already described the importance of being socially connected. Technology is our friend. Each of us have devices that we can use, but instead of just leveraging those devices to text, to tweet, why don't we pick up the devices and make a phone call? Send a letter. Do something that would surprise individuals. Make sure that they know you're thinking of them because we all need support right now. And unfortunately, it's cruelly ironic that in a time of such great stress, we are not able to lean into each other socially the ways that we were before COVID. Get people facts. Part of the reason webinars like this are important and part of the reason why each of us must stand on our own podiums and talk about the importance of mental health is because there's a lot of information out there and not all of it's good. So let's clear the air. Let's make sure that people are aware of how COVID is impacting our mental health. Go to the Kaiser Family Foundation website that I already talked about. Use those survey data. Look at the resources. Provide some type of clear scientific recommendations to friends that have questions about mental health. They're there and we should take advantage of them. And then last but not least, how do we give people care? I described that briefly in our Healing the Nation, but we must come to a place that we make care easier for people to access. Too many folks in this country get denied care or they have to wait too long for care. And I think your state, like all other states, could do a much better job decreasing the fragmentation that we see throughout our states. I had the privilege to work and live in one state where there was 42 different funding streams for mental health in that state, including substance abuse. And what you clearly find out is that each agency that has a dollar going to communities for something around mental health oftentimes does not have accountability. And there's a very unique opportunity right now, and I hate to say it, but when our states are having some budget shortfalls, mental health is usually the thing that gets cut alongside schools and other things that are so important. Let's really consider how much we cut from where, because we don't need to decrease our investment in mental health at all, because we've never fully invested in it. But we also need to pay attention to the structure of how mental health is laid out administratively within our states. Are there ways that we can better streamline administrative functions, financing functions, all in service to a more integrated and comprehensive view of our mental health? So what are we doing as an organization? Well, I've told you a little bit about some of the studies and reports that we've been putting out, As an organization, though, we're trying to apply social movement principles to mental health. And if you know anything about social movements, you know that there's a couple of things that you have to have, three, in fact. One, there needs to be a very clear consistency in language and vision and goal. What are we trying to do? Two, there needs to be a financial engine, something that is providing financial support for the movement that could keep it going. And three, there needs to be a policy or political muscle that really pushes policy through. And in cases where we might need to be more politically active, we get involved in that. Just today, a new organization was launched in the United States called Inseparable. This is a new 501c3c4 mental health advocacy organization that's aim is to really provide that policy muscle. As you can see on the slide, we've already started a small campaign. We believe that the name tells us everything. If you go to the website inseparable.us, you'll learn a little bit about what we're trying to do. This organization was founded in part by investments from my foundation, but it was also founded in part by investments from many individuals across this country who had experienced loss, suffering, and who wanted to heal. And they knew that one of the best ways to do that was to really address some of the issues of policy in a much more robust way. That is what Inseparable is trying to do. So skip down that too quickly there. So let's join together in lifting each other up. That is the byline for Inseparable. That is what we're working on together. And you can see here that there's a lot of information that's out there that you can use to assist in us working towards this. And issues of policy are going to be issues that we must continue to talk through, or else we will not be able to really move the needle on some of the outcomes around mental health. Policy is my passion. It's also everyone's responsibility. We sometimes think of it as just the responsibility of someone else. That's the lobbyist or the government relations person. But no, policy is all of our responsibilities. I conclude today's talk with a picture from my window of my study. This is a group of teachers who, physically distancing, came in a bus with masks on, and they were showing up at all the kids in the neighborhood. They were singing songs, they were honking the horn, they had gift bags and goodies, they had signs they put in the yard, and it was all a reminder of how important we are to each other. That at the end of the day, I can talk about financing, I can talk about delivery, I can talk about policy, I can show you the best data and survey results you've ever seen. But if we forget about why we're doing what we're doing in the first place, which is to take care of each other, then we've missed the boat. We've missed an opportunity. So I want to see mental health, the mental health community, doing things like this. I want to see us showing up in people's homes and honking on horns and smiling and showing love and all the things that we need to do, putting signs in yard. Let's reintegrate mental health throughout our community and make sure that it's a part of our day-to-day life. I want to conclude by thanking you. Thanks for the opportunity to share briefly some of the data that we've been working on. I thank you for what you do every day to serve the folks on the front lines who are in dire need of your services. Without you, we will really be in a world of hurt. And I know that you might be in a world of hurt right now too. Each of us are not immune to the impacts of COVID-19. Even if you're the most well-trained, seasoned clinician, you're going to experience some stress, and all of that requires us to really lean into each other. We must take care of our mental health system, but we also must take care of the parts of it that work best. We do not want to keep the things that have not been working. And if anything, COVID-19, like many folks are learning new skills, they're learning how to cook differently or exercise more, or learning how to paint, or learning how to just spend time with themselves and reflect. We also should be doing the same thing for our mental health system. What's working, what's not? How do we continue to drive towards a system that really puts all of our needs first? Thank you for your time today. And if there are questions that we want to have, I'm sure there's a way that we can give them to you. You can chat them in the chat box here, and we'll return your answers to your questions as quickly as we can. But thank you for your time today.